A very good evening and a warm welcome to all our esteemed guests and to dear learners. I am Dr. Riya Chakral from the Homeopathic Academy, and we are here today to discuss a very interesting topic, understanding Boger with Dr. Shashikant Tiwari. We have Dr. Tiwari live with us right now. But before we go ahead with this webinar, most of you already know about the Homeopathic Academy. But for those who don't, let me quickly introduce ourselves. So, the Homeopathic Academy, or THA as we call it, is BGen's effort towards digitalizing homeopathy and providing a platform for quality education online. THA offers you a range of online courses by well-known academicians on numerous subjects of homeopathy at undergraduate, postgraduate, UPSC and CME level. All these courses are enriched with state-of-the-art audio-video technology, text and vector animations, giving you an HD quality audio and video experience made by a dynamic team of qualified doctors, video editors, and many more professionals. These courses will perfectly complement your studies to make learning an extraordinary experience. On your screens, you can see some of our courses currently streaming on our website, www.thehomeopathicacademy.com. You can also see the course on Repertory at a Glance by Dr. Shashikant Tiwari. Here, Dr. Shashikant Tiwari will teach us the basics and more of the various repertories and the methods of repertorization for correct prescription. So, coming back to this webinar, Dr. Shashikant Tiwari, can we please have you here with us? Sir, please turn on your audio and video. Good evening, sir. So, yes.
Good evening. Good evening.
Thank you so much for being here with us, sir, today. So, though you need no introduction, still I wish to introduce you to all our learners today. So just give me a moment to do that. So Dr. Shashikant Tiwari, he is a renowned homeopath with plus 39 years of clinical experience with several publications, awards and recognitions from prestigious government and private organizations. He is undoubtedly one of the most experienced and phenomenal homeopathic practitioners and teachers. He has done his MD from Baba Saheb Ambedkar University, Aurangabad. He is doing his medical practice in his clinic. He is a guide for PhD in Homeopathy, University of Jaipur. He is giving expert lectures for the PG students and teachers at various homeopathic medical colleges. He is also a member of Drug Proving Committee of CCRH, and he's the principal of Father Muller Homeopathic Medical College and Hospital, chairman of Rajiv Gandhi University of Health Sciences, Bangalore. He's a director of NIH Kolkata. He has various publications in his name, especially Essentials of Repertorization, which we have all studied, Homeopathy and Childcare, Manual of Homeopathy, a series of articles in homeopathy. He has co-authored many books, also has written articles and scientific research papers. As you can see, clinical research projects also he has been associated with. And apart from that, he also organizes free medical camps and services and for a social cause. So that's a little about our esteemed speaker for today. Thank you, sir, for being here with us. And before I hand over to you, let me explain our learners how this interface works. So on the right-hand side panel of your screens, you have a short chat box. You may type your questions or whatever message you have for Dr. Tiwari right there and press the button next to it to send it to us. I request you all to send your questions only after sir's lecture is over, as that might disturb him and we wouldn't want that. So without wasting any more time, let's start learning. Over to you, sir.
Thank you, Dr. Riya. It was nice to listen about new so details introduction, and I must thank THA also for organizing this webinar. Now coming to the topic, we'll directly go to the topic. Today's topic is understanding Boger. Boger is one of the very important person in homeopathy. You can say he is one of the pillars in repertory and repertorization. He has taught the way of repertorization, which is very practical. If you say important people in repertorization and repertory, the three name comes: Boningashans, Boger, and Kent. And these three pillars are very strong to keep this repertory on very practical level and at very educational level. So you will come to know slowly about Boger. Today's topic is understanding Boger. This topic is selected because Boger, being a very practical man, being a very elaborate author, as well as a good philosopher, practical person, he's not well understood because why I say well understood, because many people do not use his repertories, and now people just go for computer repertories without understanding the basic of Boningashans, Boger, and Kent. So today's topic will explain how Boger has given his best to the repertory, how we can make best use of that best which he has given to the repertorization. So, welcome to this presentation. This already, introduced by Dr. Ria. Boger was born on 13th May 1861, and his father name is Cyrus, and Isabel is the mother. He had graduated in College of Pharmacy, and later he studied in Hahnemann Medical College and qualified himself as homeopathic doctor. He had a commendable knowledge in homeopathic materia medica. You can have example of synoptic key. It's a very, very important book in materia medica, though the students do not see it because I think because they are not guided properly. Every student only tries to understand Allen's keynote and memorize few more symptoms to understand the materia medica. But I recommend that synoptic key also should be one of the important book for materia medica to the students, because this gives the full picture of homeopathic remedy in a very, very systematic and logical way. If you see synoptic, you will understand location, sensation, modalities, concomitant, and pathological journals. Very, very clearly written in every medicine. And this is called that it is written in telegraphic language because very, very important words are used, and one word would mean so much. So maybe that is the reason students don't refer. But if they are guided properly by the teachers, that will become very useful. So my meaning, my uh, wish to say this is because he had a commendable knowledge in materia medica, and that we can understand if you refer synoptic. Also, if you refer characteristic of materia medica, which is given in the beginning of BBCR, he has worked over it, though he has taken it from Boning Hassan, but he has also polished it and made it more and more useful. Then he had master in homeopathic philosophy. And also I recommend you to study his book, Studies in Philosophy of Healing. This is one of the important book. Like Kent has Kent lectures, Roberts, all these philosophy books are there, but people don't read this. Studies in Philosophy of Healing. This is written by Boger. Very, very important book to understand the patient as well as remedies. And then he frequently lectured in many places, in medical colleges, and he was very popular in lecturing as well as in practice. Then he passed away in September 1935 at the age of 74. He died from food poisoning after eating a tin of home pressurized tomatoes. Uh, this is the these are the people who have made homeopathic repertory as a very, very useful discipline. She started with the master himself. He had ideas, he conceived the idea of repertory, he wanted to make a repertory. And I have seen his repertory, handwritten repertory, which is kept in the museum. Very thick book, handwritten. You can, if you see that, you will be surprised how Hahnemann wrote such a big and large volume just writing by hands. How much time he must have taken. But he did not publish because he was very much a perfectionist, you can say. He wanted everything to be perfect. He said himself, I am not happy with this work, so I don't want to publish it. Then you have Kent, Boger, Boninghashens, and the last one, this fat person is Nar. He's a father of concordance repertory. So these people have made a very, very important contribution in repertory, and they are the main people. And now people have worked on that, and there are very, very useful modern repertories. Now let us see about Boger and his philosophies, his practice, his contributions. Boger started his medical career through clinical practice at the age of 27 years at Parkersburg in 1888. This was the time when contributions from many stalwarts of homeopathy made the homeopathy very popular. This was the era when homeopathy was the main leading medical system and it was appealing to public. The new system of healing art was preferred system of medicine because of its ability to cure, because people practiced with full philosophical aspect, giving importance to the image of remedies and not practicing just pathologically. By this time, there were variation in methodology. But then came what? Then people started clinical practice, clinical prescribing, and there were clinical repertories also, which created a confusion. So people had a lot of confusion. Which is correct? What should be the actual methodology? And then the Kent emerged and he became highly philosophical because he gave a very philosophical methodology. He said, to understand the disease, we have to understand the inner man and his deviation. He said, it is the man who is sick, not the parts. So that gave a very high aspect of homeopathic philosophy. His explanations and deliberations of homeopathic principles attracted a large number of homeopathic students. And students from all over the world went to America to study homeopathy. I had a teacher who was direct student of Kent. He was teaching in Calcutta. So people from all over the world, they joined him as a student. Yeah, and he became very popular. His philosophy became very popular and homeopathy was flourishing those days. Thus, a new era in homeopathy was perceived. Boger, while practicing homeopathy, made a thorough study and used Boninghashten's repertory, Jar's repertory, Possert's repertory, Wells' repertory, and Kent's repertory. Also, he was aware of practice of Herring's, Nurr, and Clark at UK. Being a practical person, he acknowledged the importance of understanding inner man as advocated by Kent. But expressed his inability to perceive the mind of a person in short time of the case taking, unless there was an obvious change in the whole personality of the person. He accepted the Boningerson's way of understanding the whole presentation of symptoms. So he wanted to study the whole symptomatology first, and thus understanding the disease, totality, and remedy. So he said that try to understand the presentation and then go back to man. So he said from parts to the man, not from man to the parts. To understand it, he expanded Boningerson's views by elaborating the principles of prescribing, which was fully in line with Master Hahnemann, and added the contents of repertories conceived by Boningerson. So he improved over the contents and also philosophy. During his long career in medical practice and research, Dr. Boger contributed a lot by his writings and successful treatment of incurable cases. It is said that patients reported to him from various parts of USA because of his ability to prescribe right medicine even in incurable cases marked with common symptoms. Common symptoms are some of the symptoms which say that this case is very difficult to cure, because when common symptoms are more, the characteristic symptom becomes less, and our prescription is mainly based on characteristic symptoms. But Boger, he practiced well. He cured the cases even with common symptoms and also characteristic symptoms. His method of finding out a remedy through analysis and synthesis and construction of repertory, then writing several other books and lively translation of several medical books from notable German authors has made him a renowned author and a physician of great eminence. So all these works he has done. He has written books, he has translated, and he has suggested a methodology. Analyze the case and then synthesize. Pick up whatever is important, which you got in analysis. His probing of Summerskite, it's a medicine, is also a valuable contribution to the profession. He taught his students in American Foundation for Homeopathy postgraduate school from 1924. In the course of his translation, repertory of antisoric, he was further convinced that there was a need for a different and more practical repertory. Therefore, Boger undertook a major work of rewriting Boningerson repertory. This he did by adding time, aggravation, amelioration, and concomitant in a detailed manner at the end of every chapter. Those who have seen Therapeutic Pocketbook, they must note that in every chapter there are no modalities. Modalities is given towards the end, and that same modality is applied to all the parts. That is why we say Boningerson methodology, one of the important thing is doctrine of analogy, a grand generalization. So all the parts will have modalities which is given towards the end, and that towards the end whatever modality is given is applicable to all the parts. This was main point for criticism also. So Boger made all the chapters enriched with aggravation, amelioration, and concomitant, so that this criticism were nullified, and this became a very useful book. So he improved Therapeutic Pocketbook. He took from other sources, and he took the methodology of construction of antisoric remedies, and then he made a very useful BVCR. So outcome BBCR was enriched with many new chapters, new rubrics and medicines, which was published in 1905 as a first edition. The importance is given to pathological journals, causation, concomitant, and modalities. So each chapters you will find causation, concomitant, and modalities are there. And pathological journals mainly you find in a chapter sensation and complaints in general. Bogus views in understanding a case. General picture. See, I have given some points because this is the whole gist of philosophy of Boger. But only points are given because it is a very, very elaborate chapter, you can say. General picture should be given more importance compared to keynotes. That is his statement. Objective symptoms are more reliable and concrete because he says that subjective symptoms may differ from physician to physician when he takes the case, but objective symptoms may not differ because what we see as a pigmentation black by one physician, it will be same by another physician also. But what feeling a patient is undergoing and describing, it will be understood by one physician different way than other physician. So he said that objective symptoms are more reliable. And if objective symptoms are present, give more importance to that. Then he has said, last symptom is the most important clue for the simillimum. Here, it may not be amiss to point out that nature tries to attract our attention to the most important things by developing them last of all. It is said that even human beings are created towards the end because earlier, from unicellular to multicellular, the systems, finally man was created. So that is how he is most important being on the world, on the earth. Like that, the symptoms which is produced towards the end, that is very important. He has given one case also in his book of studies in philosophy. One case he has narrated where some symptoms appear lastly on the tongue, and based on that he prescribed the right medicine. So this is one of the very important point. Observe for the last symptom which has appeared in the case. Even if the case is incurable and you are able to catch the last symptom which is characteristic of the person, not the common symptom, then there will be a very good response by the medicine. Then he says, in confusing presenter, prescribe for the most recent phase. Suppose a patient comes with multisystematic disorders. You will see what is the last, because everything will be so much confusing. So see the last phase, see the recent phase, see the last few characteristics, prescribe for that. Maybe patient will be cured, or after the prescription, the symptoms may be more clear. If physician can get the patient's mode of thinking, see he comes to the mental symptom, his involuntary ideas, he can build up a picture of his mental process. This is often difficult. The psychoanalyst takes hours and weeks to do it. The physician rarely has so much time at his disposal. See, he's not against mental symptoms. He's only expressing the difficulties to get them. But I will tell you, he has said at many occasions, if you get them, they are very important and use them. But if you don't get them, then rely on other picture of the disease, other picture of the person, and prescribe for that. Don't say that now because you are not getting mental symptoms, you can't treat a person. You can treat even otherwise because other symptoms are also important. Then he says that every symptom picture shows three phases: constitutional, the inner man, you can say makeup of the person; general conformation, the changes which is found on the physical and mental level; and the peculiarities, the characteristics, the changes in modalities which is not found in other person with the same disease. All three must be met before the symptom can be seen. Then he comes to that. Finally, the best indicated remedy is one holding the closest similitude thereto in location, origin, modalities, mental condition, concomitant, peculiarities, and time. So if you find a remedy which covers all this in a diseased person, that is the best remedy. That is the indicated remedy. And then this is the totality. All these points one must has to go through to understand the person. What are the changes in personality and temperament? See, he's emphasizing about the changes, not that you go unnecessarily on the details. You have to find out how was the person earlier and what he has become today when he comes to you. What was his bodily makeup and mental makeup earlier, and how he has changed after the disease has come. So that means the changes in the personality, change in the temperament, which is brought by the sickness. That is what you have to notice. Then peculiarity of the disease. What disease peculiarities are? In what way it is present in this person? Seat of disease is the location and extension. Concomitants. Concomitants means what comes along with the chief complaint and the cause. There are some more discussion about the cause later. So cause means what has caused, what has brought the disease. Later it will be explained a little better way. Then modalities, what makes it worse, what is making it better. And timing. See, Boger has given a lot of importance to the time. You see in synoptic, the repertory itself starts with time. You see the BVCR, at the end of every chapter, there is a time. So time, he says that time is very important. What time the disease becomes more, what time it becomes less. Even if you see the moon phases, one of the very important book which he has authored, the time he has mentioned is very important. Which day of the month, what are the changes in the nature which affects the person. So what I say is time which is given important by Boger should become guide for us also in our prescription and our study of remedies as well as the disease peculiarities. It is obvious that Boger has favored the understanding of the whole phenomena at the level of constitution, diagnosis, and ongoing pathology, because nothing can be neglected. Here he differs from Kent. Kent says that one general, if you know, you can prescribe and you can ignore the particulars. But it doesn't mean that Kent is wrong. What he says is one general, if you get, and most of the time it is seen that what generals you get that covers the particular also if you see the remedy. So in that way he was on a very high level. But at very practical level, these three things what Boger is telling is more favorable for the learners, for the beginners, and for the practitioners. What he says is the level of constitution, diagnosis, and ongoing pathology has to be known to prescribe a remedy. Then, Boger's appreciation of time dimension, causative modalities, tissue affinities, pathological generals gave a new vista in understanding the case. So, in a case, what he says is all this has to be understood. Then some of the things which I have taken from his philosophy book, what he says is, there is one article, Some Thoughts on Prescribing. He instructs a physician, first try to elicit the evident cause and course of the sickness down to the latest symptom and effect of such influences. Such influences means The changes with the like time, temperature, open air, postures, being alone, motion, sleeping, eating, drinking, touch, pressure, discharge. So, what are these things which are, I mean, how they change the course of disease? That is important thing. So, he has given importance to the cause, from cause to the present state, and then modalities, circumstances, how they change them. Second point comes the modalities and consideration of mental state in order of importance. So here what he has said there only, he is writing again that modalities are also very important, and then consideration of mind. So he is not neglecting mind. Third, entire objective aspect of expression of the sickness, including the state of secretions. Lastly, the part affected must be determined, which also brings the investigation in touch with diagnosis. See, he clearly writes about investigations and about diagnosis. These are must. He further states that by going over the above rubrics in order named, that means the cause, the changes, the objective symptoms, the contour of the disease picture would be pretty clearly outlined and would point fairly well towards the simillimum. And the prescriber has only to keep in mind that actual differentiating factor may belong to any rubric. So it may be modalities which can differentiate and finalize the medicine. It can be concomitant, it can be time, it can be anything which is earlier taken and which is different from one remedy to another. That becomes differentiating point. Now, as I said about causation, he has said further. About causation, he says, whether the causation comes from without or arise from within, the homeopathic simillimum cannot be chosen with safety without taking them into account. So he gives so much importance to causation. About modality, he says, they individualize and define every sickness as well as every drug. See how clearly he mentions. The way he mentions makes it very clear what is important and what is not important. He wrote in article, how shall I find the remedy? The interdependence of mental and physical states is so great that we never afford to overlook it. They, moreover, always clarify every other symptoms, often in a decisive way. So, mind can finally decide the remedy also, and physical also finally decide the remedy. Decide remedy means they are so important that they can give you the right indication, the right way of selecting. So they are interdependent. Mind affects body affects mind. And that has to be taken care in your prescribing, in your totality, in your selection of remedy. See, there are books which Boger has authored. To understand him, all these books has to be gone through. And they're not big things. I mean, there are some of the small books are there, some big books are there. The books which we have seen, like BVCR, is the biggest book of his. Then comes Synoptic Key. Then comes Card Index Repertory and General Analysis. Card Index Repertory may not be available now, but I think General Analysis is available with Bees and Publisher. Then comes Additions to Kent Repertory. See, this book is not known to many of the people. And this is very important contribution. This also tells, sorry. This also tells that Boger has gone through the Kent repertory word by word, pages by pages, rubric by rubric. And he has suggested around 30,000 corrections. One of the very important correction which I remember when I was referring a rubric, like anticipatory anxiety. Anticipation aggravates is given in Kent repertory. And many of the times we refer that rubric and finalize medicine. See, in that rubric, natromure is not given. But in this book, Additions to Kent Repertory, he has suggested anticipation, add natromure. Because natromure is equally important for anticipatory anxiety, which was not known to me till I referred that book. And after that, I don't discard natromure because it does not cover anticipation. It covers, and it may be discarded because of some other symptom, but not because of this symptom. So this is very, very important understanding given by Additions to Canterbury. Many of the mental symptoms also he has corrected and he has added. So my dear friends, don't be under impression that Boger was not aware about Kent repertory. He has gone through the repertory word by word, and he has incorporated all important things in his repertory also. So he becomes the most modern repertorian among three. Then he has authored Times of Remedy, Moon Phases. What valuable books are these? You can understand only when you go through. Then what I was telling about is Studies in Philosophy of Healing. So all these books are there, but we should refer it. And then only we can understand what Boger was actually in his homeopathic practice and profession. In order to understand Boger in totality, one has to go through the whole series of literature, which he authored from time to time. His each book is complete in itself, but not the ultimate to delineate the totality of his views, because they're all separate books. BBCR is his last work, which was published after his death in 1935. Perhaps, this is what I think, and I'm very confident in this statement also, perhaps the Boger could not give final version of his theory and practice. And one has to understand it by combined study of all his work. But then not very easy for everyone to go through. Now I have taken up one project, taking all these books and making a final version of Boger's repertory, which is being done, and half of the work is done. Hopefully it will it will see the light of day in few months, or maybe end of the year, or maybe next year, depends on many factors. Coming to the point, since BBCR is his last work, it gives at least maximum of his philosophy and practice. So we'll go through BBCR to understand at least a large portion of his philosophy, not the total portion, because totality is understood when you go through the series of his literatures. But I have taken from all this in my presentation so that you are not left out without knowing him much. Now, this Dr. Dario, he's a famous because he wrote the foreword of Complete Repertory. What he writes about BBCR is, I discovered that Bogus Boningan's repertory is a real gold mine for all kinds of symptoms. Though he has written forward to Complete Repertory, which is a modern repertory, supposed to contain everything from all sources, but he still says that BBCR is real gold mine for all kind of symptoms. J.S. Clark was very much in favor of clinical prescription, clinical repertory. He has authored also. He says, Dr. Boger's large work, Boningason's characteristic and repertory, contains Boningason's characteristic materia medica as well as the repertories of all his work combined into one. It is valuable compilation. Now, how the journey has come from Boninghashan's Antisoric to BBCR, because his first work was translation of Antisoric Remedia Boninghashan in 1900, and then from there he has shown a lot of interest, a lot of work in repertory field, and finally he published BBCR. So, how he has gone ahead? Let us see. Boninghashan's pioneering work was in great use during the second half of 19th century because it was the only work of its kind available to practitioners. However, with the publication of Kent's Repertory in 1897, it receded to the backstage. This is a fact. Consequently, Boninghashan's work as well as his principles were overlooked. By publishing BBCR, Boger creditability resuscitated Boninghashan by what all thing he has done. He has refined, he has enriched the fundamentals and recasting the structure and methodology. That is what was required. Then this book has a base, certain philosophy and the way of construction. What philosophy it has, on what philosophy this book is working, we have to go through because we have to understand the philosophy of this book, the principle of this book, so that we can make the best use of this BBCR. Otherwise, if you just refer, the same way mind chapter is there, abdomen chapter is there, sensation complaints, sleep, dream, all chapters are there, which is found in any other repertory also. But unless we know the principle and construction of this repertory, we may not be able to make best use of it. Construction, I am not going to detail because it will take a lot of time. But principle, I want to discuss with you, I want to explain it in gist so that when you open the book, you understand what you're opening. You understand where to refer. You understand how to use this book. So the first philosophy of this book is doctrine of complete symptom and concomitant. Complete symptom means, location, sensation, modalities, as well as concomitant. Doctrine of pathological general, doctrine of causation and time, clinical rubrics, evaluation of remedies, fever totality and concordance. This makes the whole book. This makes the principle on which the whole book is lying. Little discussion will be there about each point in next slides. Doctrine of complete symptom and concomitant. A complete symptom is that which consists of location, sensation, and modalities. During the case taking, the unreasonable attendance is also called concomitant. Of main symptoms are also noticed in relation to time and circumstance. That means before, during, or after, which are concomitants. So this is one principle. And if you open the book, you will see the chapter first contains location, then contains the symptoms of this location, that is sensation. Then it contains modalities, then it contains concomitant. So each chapter is based on this methodology: location, sensation, modalities, and concomitant. Concomitant, you will find all this before, during, and after. So once you understand the complete symptom theory, you understand the arrangement of the book BBCR. In BBCR, complete symptoms and concomitants are well arranged with the most of the chapters, and it is seldom necessary to do grand generalization regarding sensation and modalities. So he has overcome those bitter criticism about Boninghashan by Kentian school methodology. Then comes doctrine of pathological general. Here I wish to say something to the learners. Pathological generals is not pathological symptoms. What it is, we'll come to know. Boger was not satisfied merely following the principle of complete symptom. He went further to seek general changes in the tissues and parts of the body. Today, with our advanced knowledge of medicine, it is not difficult to understand the importance of pathological general mentioned by him in the repertory. See, the general changes in tissues and parts of the body will tell you the tendencies, like some pathological, some like healing, pus formation easily. This is a pathological general. Tendency to get affected by cold, uric acid diathesis. There are a lot of diathesis which comes under pathological generals. So these are the changes in the whole person which makes him sick. So this is also even miasmatic. See, under sensation and complaints, we will find the miasmatic changes are also given. There are 9 constitutions given. Those constitutions are pathological generals. Those changes at miasmatic level are constitutional and pathological generals. So pathological generals has a wider aspect of understanding, not just pathology. So please try to understand the patient from this point of view. What are the general changes in the tissues and parts of the body? That becomes pathological general. Pathological generals tell the state of the whole body and its change in relation to the constitution. They help us to concentrate more on concrete changes to select the minimum. The chapter in the book Sensation and Complaints in General is full of examples of pathological generals, which include discharges, structural alterations, constitution, diathesis, etc. Then doctrine of causation and time. Boger has given adequate place and importance to the causation and time of the expression. Each chapter in the book is followed by, as I said, time aggravation. The section on aggravation also contains many causative factors. From this point of view, causation and time factors are more definite and reliable in cases as well as in modalities. In his own practice, he has successfully employed these factors to find out some minimum in the shortest possible time. His other works like also substantiate the importance of these factors. In the chapter Choosing the Remedy, he gives importance to miasmatic cause as well as exciting cause. He gives more importance to causation and general modalities. That is well explained in many books, like even Synoptic Key. If you see the preface, he gives a lot of importance to causation and modalities. Then clinical rubric. See, clinical rubric, even in Kent, few of them you will find, but how to use them is not well understood. But as per his principle, he has explained that even in common symptoms, even in a pathological conditions, you can have those rubrics which are given as a clinical rubrics, and then differentiate those group of remedies with the help of modalities and concomitants. So what I say is Boger appreciated the use of clinical condition in grouping remedies and their use in selecting remedy in absence of characteristic symptoms in the case. Remember, this cannot be used in all cases. Only when characteristic symptoms are absent, then go for this methodology. These clinical rubrics are useful to arrive at a group of medicines which can be further narrowed down with the help of modalities and concomitants to select finally the most similar remedy. And then evaluation of remedy, once you open the book, you'll understand there is a capital word, there is a bold letters. These are the typography used in the repertory part. And this typography gives you the order of importance. Like gradation 5 will be most important and gradation in bracket will be least important. Then very important thing about fever totality, and this has become very relevant in the present situation of this pandemic COVID. I have repertorized few cases with the help of this chapter, and I have found the correct remedies. See, any fever case will have three stages: chill, heat, and sweating. And all these stages you will find Boger has given each stage time, aggravation, amelioration, and concomitant. And this becomes the whole basis of prescription. So he says that each stage will have a totality. So if you don't have chill, don't worry. See the totality of heat stage. See the totality of sweating stage. But if you have clearly defined chill, heat, and sweat, take details of chill by time, aggravation, amelioration, and concomitant. Same thing applicable to the heat stage and sweating, and repertorize it. You will get a correct remedy even in very complicated cases of fever. Some of the cases of pyrexia of unknown origin also you can treat with this fever totality chapter. Concordance, little less understood but very, very good chapter. This helps you to understand the relationship of remedies. That means followed by complementary second prescription. Second prescription you can have from this chapter. Now I'll give you one or two cases. This is the last few presentation, which was based on his philosophical understanding, and then it was worked out with BBCR, and it gave a very good result. This is one case of left-sided chest pain. Left-sided chest pain, you may be knowing as a medical person, is sometimes very, very dangerous. And as soon as left-sided chest pain comes, we as a physician are not very comfortable to attend them. And sometimes we attend with half-hearted. Sometimes we attend with a lot of fear also. But see what has happened in this case. This case give you, it may give you a little more confidence about treating such cases. This is a person of 64 years. He came to our OPD and he had chest pain. Detail is as follows. Chest pain is from left side to left scapula. Since morning, it has become more. What is the type of pain? Is constricting pain. Pain as if something heavy is pressed, radiating type of pain, uneasiness and restless feeling. Exertion aggravates, walking aggravates, lying on right side ameliorates. 3 marks. Then there are three very important things he said. Weakness, he feels very exhausted. Headache, 3 marks. Whenever he gets chest pain, it has got headache. See what uh, uh, same time it's coming something which is very peculiar. Then giddiness. Patient also had distension of abdomen with flatulence for the past 4 to 5 months, which is more after eating. He used to get chest discomfort on and off and was treated for the same. Hence, he decided to take homeopathic medicine. Now the pain is severe. He had earlier flatulence. He thought this may be flatulence, and because he's been taking so many medicines, so let us go to a homeopathic doctor and find a correct remedy, which is to avoid the recurrence. Past history. 12 years ago, he had severe pain in the chest and was admitted in ICU for 3 days. He used to get some mild pain occasionally, but continued his activity. 3 years ago, he had once again severe chest pain, admitted in ICU. After that, he was advised to avoid strenuous work. He's known hypertensive for last 3 months and is on medication. This is general physical examination. Most of the things are absent. What is the findings are pulse rate is 75, BP is also okay, respiratory rate 22. Chest inspection, shape, barrel. no engorgement of the veins, visible pulsation, 2 centimeter lateral to mid-clavicular line, palpation, no tenderness, apex beat shifted, lateral to mid-clavicular line, tapping apex beat, auscultation S1, S2 heard, S3 at apex, but some abnormal sound can't be specified. Some kind of little different sound than the normal was noticed. And this is the acute totality. The first symptom what we have taken is concomitant. Chest pain with headache and giddiness. Chest pain better lying on right side. This is modalities. Chest pain constricting. This is sensation. Chest pain as if heavy pressure sensation. Chest pain radiating to left scapula is also sensation and pathology. Chest pain with uneasiness sensation. Chest abnormal sound is sensation and pathology. So this is the totality, because nothing much is available in this case. So what we have got is concomitant, we have got modalities, we have got sensation, we have got location, as well as pathology we have got. Since the case has concomitant modalities and characteristic sensations, there are many methods in Boger, but this is one of the method where concomitant is given importance. So third method of BBCR was followed by repertorization. And these are the rubrics taken. First rubric is head internal heart symptoms with. Chapter head internal, aggravation chapter. Constriction chest inner, that is the chapter. Pressure load on weight, chest internal. Uneasiness, heart reason of, this is also a chapter in BBCR. Scapula pains extended to heart reason of. Sounds abnormal, heart reason. See, these are all very, very beautiful rubrics found in BBCR. He has given sounds abnormal heart. And it is found in chapter heart reason of. So all these rubrics are taken. See, from top you see the concomitants are taken, modalities are taken, then sensation is taken, and the location also is taken. And what is coming is the 3-4 remedies coming. This is little small. Yeah, cactus is coming, spicelia is coming, phosphorus, nasa, and digitalis. Patient was advised for complete bed rest and prescribed NASA 30. And these are the charts which we maintain in the IPD. We have been following daily, twice or thrice. Next day we thought to do some investigation, because not next day, the evening, he came in the morning. Because the chest pain was there, left-sided chest pain. If you don't do investigation, it will be, you can say, negligence on our part. So we have done it, and see the ECG. There is pathological Q wave, T wave inversion, pathological Q waves, elevation of T wave inversion, ST segment elevation, T wave inversion, ST segment elevation. So these are all details of ECG. Finally, ECG summary was he has got ischemic heart disease and myocardial infarction. So the diagnosis came as myocardial infarction. He was admitted in IPD with a chest pain, and this created a lot of tension among the physicians. We, the team of physicians in Father Muller's, we thought what will happen now. He has got myocardial infarction. We have admitted him in general ward, and but his condition was better, stable. So we thought, let us get an opinion from a heart specialist. Before that, we have done some more checkup, and this is echocardiogram. Echocardiogram also tells ischemic heart disease and moderate LV systolic dysfunction. So when the cardiologist came, he examined him. He was our friend. And he said, no doubt he has got myocardial infarction, but he's stable. And if you want to continue, continue. I think he may not require any ICU admission, and you have controlled its pain properly. And he's out of danger. When he said that, we were confident and we continued the medication. And then he was there for 7 days around. When he became all right, he started walking in the, because first we did not allow him to walk also. Then he started walking, he had normal food after 7, 8 days. Then we thought we'll discharge him. And then before discharging, we have taken ECG. T wave inversion, pathological Q waves, ST segment has become normal. That was elevated in the previous report, and that was the main problem. That indicates myocardial infarction. ST segment normal in all this V3, V4. And this ECG summary says myocardial infection resolved. ST segment elevation absent. So this was a case, my dear friends, based on the bogus methodology of giving importance to concomitants. And then accordingly, we have taken the totality, we have referred his book because he has got all those relevant rubrics also in his book, which you may not find in other books. So he has arranged his books, he has enriched his book as per his philosophy. So this was one of the methodology, giving importance to concomitants and curing the cases which are seems difficult and incurable. And then this is one more method. This is the last case. With the diagnostic rubric, where we have followed even location sensation modalities method or clinical rubric method, it's a combined. See, this is one patient with liver abscess. He came in the March, and then this case I have taken because it is very important and very relevant and very good example for the methodology. He had a complaint of pain in the right upper abdomen and restlessness, increased temperature. These are the complaints. He also suffered from severe weakness and body ache, along with bitter taste in mouth. He went to a hospital for checkup and treatment. And then ultrasonography was done, which revealed liver abscess of 7 into 5.9 centimeter. This is the report. See the report impression is a liver abscess with early area of tissue breakdown. This report itself was a little frightening to him. He was advised immediate hospitalization and treatment, including required surgery. But he did not wish to go for operation. Hence, he came for homeopathic treatment. See the courage of the patient and also appreciate the courage of physician. Where there is a liver abscess and that size is big, there is a breakdown of the tissues, this case was taken and evaluated. Then you only decide whether it was worth treating or not. This is the doctor's note that patient should be admitted. Then we have taken some more details about him. His appetite, don't feel like eating, slight nausea and easy satiety. no desire for food, but can relish a slight pungent food, likes hot food and drinks, bitter taste in mouth, no change in thirst, but prefers to take water frequently. Stool, constipated, forehead, there is sweating, mind, a little anxious about the prognosis, don't want to go for any surgery, and irritable person. Likes cold weather of South India, wants fan. Now, see, in this case, there are no characteristics. A bitter taste is a common symptom in liver problems. So we tried to find out, but he was not further elaborating anything. He just came with the reports of ultrasound and chit of the physician for admission. And then whatever I have told you, he expressed only those symptoms. So what we have taken is location, liver and hypochondria. Abscess hypochondria is a diagnostic symptom. Bitter taste in mouth, concomitant. Sweat forehead, concomitant. Constipated, concomitant. See, they are not very, very strong concomitants. But since they are available only, and also because they are little prominent, see, the common symptoms also becomes important when they have intensity and when they mask other characteristics. So when these are only available, they are taken as a concomitant. Like sweat forehead is certainly a very great concomitant, but bitter taste in mouth is a weak concomitant, but it's a concomitant. So only these rubrics are available. I mean, these symptoms are available, and they are converted into rubrics, and these are the basis for our prescription text. So they are repertorized. And then he was prescribed Silesia because that has come on the highest, and this covers also other symptoms. Once a week, empty stomach advised to report follow-up after 10 days because even the treating physician, me, was very, very anxious here to know the result. So I told him, if you agree for reporting every 10 days, and also if you agree for the diet, rest, and other measures, then only I will treat you. He said, okay, because I don't want to go for any surgery. So he was advised a strict diet and rest, and then he was told to come after 10 days with ultrasonography. And then after 10 days, what is the ultrasonography saying? Irregular hypoechoic lesion in the right lobe of liver, suggestive of abscess. It remains the same. But he was feeling better. Appetite is good, bitter taste, weakness is better, and abscess is little less in millimeter. Patient feels overall better. But then I thought to keep an intercurrent remedy because it was not showing the desired result, though there was totality. We have given the medicine, repetition is okay, and selection is okay. Then what next is something obstructing, miasmatic. So we have given tuberculin 1M. Tuberculin 1M, which was given because of his other past history, also we have taken, which is not given here. So his miasmatic, anti-miasmatic remedy was tubercular. So tuberculin 1M was given as intercurrent remedy, then Silesia 30 once a week, morning, empty stomach for 15 days again, and was asked to report after 15 days with investigation again with the ultrasound. This time, resolving abscess in the right lobe of liver, and size also has drastically come down. No pain, flatulence 1 plus, ultrasound 5.6 into 4.9. So this is almost towards half. Then Silesia 200 once a week was given. Patient was asked to report after a month again with ultrasound and liver function test. This ultrasound says there is no problem. Liver is normal. in size and ecotexture. No focal mass lesion detected in both the lobes. And liver function test, all parameters are normal. USG, normal abscess resolved. Advised to stop medicine. Patient overall better but has little flatulence. He was asked to discontinue the treatment. BBCR can be used in following type of cases. Cases with causation, mental or physical. See, this is the first methodology. Boger has given a lot of importance to causation and concomitant. So first methodology is if you get causation and mental level, and this methodology is very, very close to Kent. Because see, elements from grief, elements from anxiety, elements from excitement also can be taken in a bogus way because this is one of the causation at mental level. But then you will have to use concomitant modalities for differentiating those group of remedies. So this is one method where you get a lot of, very characteristic mental or physical causation. Cases with concomitants and modalities that which you have seen. Cases with complete symptom, location, sensation modalities you can use. Cases with clinical rubrics also you can use. Cases with pathological generals, I have not shown any case, but any pathological generals, if you get in your practice, please go by BBCR methodology and use the correct method, taking pathological general as the first rubric. Then any kind of fever cases. So see, it almost covers all type of cases. So if you know BBCR, you can practice well with all type of cases in your practice. Conclusion. Boger's Boningerson characteristic and repertory is a great work. And it's a great work telling about Boger's philosophy, Boger's thought process, Boger's working methodology, Boger's way of practice. This reveals everything about Boger. Boger's philosophy and methodology is a practical solution of most of the problem faced in prescribing. Cases which presents with paucity of symptoms, where symptoms are less, like one case I showed you of the liver abscess, or cases with full-fledged symptoms. Both can be worked out successfully by using Boger's methodology. Boger's work needs to be updated from authentic sources without compromising its structure and philosophy so that it can become more useful. And I'm happy to tell you today that I'm working on this, and in due time, in some more time, you will see a good book only consisting of Boger's, or you can say combining all the work of Boger in one book. Boger has authored several books which needs to be combined and published as one reference and final general report. My dear friends, life is so short. Craft is long to learn. Thank you very much. And last word I will tell you is go with the principles of stalwarts, you will never fail. Go with the Boger, go with the Kent, go with the Boningerson. They are the real guide for your practice and understanding homeopathy and homeopathic philosophy. Thank you all very much. I'm very happy that you have had a lot of patience. And I thank my all colleagues who have joined me, all teachers who have joined me, and all the students who have joined me for this presentation. Thank you each and one.
Thank you so
Yeah.
much, sir. Thank you so much for such a great and enlightening session. I want to apologize to our dear learners because we really have run out of time and we won't be able to take much questions. So if we can we take one or two questions, sir, if you allow?
Yes, no problem, no problem.
Thank you, sir. So I'll just ask one question. A learner wants to know, can we give baselinum also instead of tuberculinum as an intercurrent in the second
Yes,
case?
You can give, no problem. But if there is a tubercular miasm in the background, preferably it is tuberculinum given. Bacillinum can be given when there are many other symptoms that can be differentiated on the basis of mathematical knowledge also.
Yes, sir. Also, some learners want to know why did you choose Naja over other remedies?
Because that prominently covers the concomitant.
Okay, sir. Thank you so much, sir. Also, a learner wants to know can you differentiate a little between the top medicines that came, like the cactus, Naja, and others?
See, cactus, you know the sensation exactly how the constricting sensation comes. So that was not present. NASA being a medicine which covers the location of heart and having a great concomitant of giddiness as well as headache. That is how it was selected. Though all medicines, spicelia, cactus, they cover the heart. But since the concomitant was given more importance, the mark in concomitant is more covered by NASA. That is why NASA was
Okay.
prescribed.
Okay. Thank you so much, sir. We all want to. Okay. Hello. So, are you there with us?
Yeah, I'm there.
Huh. Thank you so much, sir. I would like to wish you best of luck for the great work you're doing, and all of us will be looking forward to it, to have it published soon and in our hands. Thank you so much, sir. And can you also say a few words about the course you have done at THA with us?
Yeah, see, this THA has made some of the courses as a video courses. In repertory at a glance, there is a course. It has 7 modules, and each modules consist of around 40 to 50 minutes lectures. I am live there in the videos explaining you uh, different things in different modules. The details can be known from THA. For example, I will tell you the first module has the introduction to repertory, principles and practice. Second module has Boning Ocean's therapeutic pocketbook. Third, BBCR, the whole detail. You will find all 7 methods from causation till pathological generals. All those has been worked out with the example of cases. Then you have Kent repertory, card repertory, modern repertories. The speciality of these courses is it has been demonstrated with the cases, so it won't be difficult for you to understand it. Because see, just lecturing without practical demonstration is a usual phenomena in our classroom. But here you can see the methodology, you can apply them, and you see the live cases there. Also, you will find one useful thing is this video you can see many times. See, lecturing, what happens when we lecture, we have gone. Few things you don't understand, and you are in dilemma. But here you can repeat the video. You can listen 10 times, 12 times, and try to understand the things. So this will be a very useful course designed by them and lectured by me in video. So you can take these courses and you can cover the whole repertory and repertorization. Thank you.
Thank you so much, sir. I would like to inform our learners that they can also avail a 30% off on the website by using the code FT30. It's a limited period time offer on all our courses. Another important thing that yes, okay. So I hope you have all answered for the review for our webinar. If not, then please do so. So let's wind up here, sir. Would you like to say some final words to our learners?
Yeah, final word is practice homeopathy on principles. Because nowadays, what I'm seeing is homeopathy is standing on the crossroad. And many of our students, sorry to say that, they're looking for some tips, some kind of easy methodology to practice homeopathy. But remember, there is no shortcut in medicine as well as no shortcut in practicing homeopathy. You have to have elaborate way of understanding the case, because Hanuman also has said, when it comes to the service of humanity, there should not be any lapse. So, my dear friends, my dear students, if you want to practice homeopathy, follow the methods. Learn it properly from stalwarts like Boninghashan, Boger, even Clark, clinical methodology. But it has to be on a sound philosophy and methodology. To know all this, what I say is repertory and repertorization is must. Somebody has said nobody can practice sincerely and scientifically without the aid of homeopathic repertories. I agree with that. I endorse the same view. I suggest you also to repertorize cases. One more thing, Kent has said, if you repertorize 10, I mean, 100 cases, then you need not repertorize further because you are expert in that field. And when the patient narrates, you understand what is the remedy. So to go to that stage, you have to go through a proper way. If you want to go to third floor, you should go to the staircase of the first floor, then second floor, then third floor you have to reach. Don't try to go directly on the third floor. There may be chances of accidents. So, my dear friends, no shortcuts. Practice homeopathy on principles and follow a methodology which is already proved useful by our stalwarts and guided by them. Thank you all
Yes,
very
sir.
much.
Thank you so much for sir for such wisdom. And also, I would like to thank you. I would like to extend a very warm gratitude on behalf of the whole team of THA and on behalf of BJN Group. I apologize to those whose questions I couldn't take up due to shortage of time. We'll soon come up with another session with Dr. Tiwari if he'll allow us. And also to inform, we have an upcoming free webinar by Dr. Saptarshi Banerjee scheduled for 28th of August, 8 p.m. You will soon receive the registration links in your mail and your social and our social media handles. Hope to see you all there. Thank you so much, sir. Thank you so much, all learners, the homeopathic fraternity who joined us here today, and Team THA for making this webinar a success. Thank you so much. Keep learning,
Thanks.
keep improving. Thank you, sir.
Thank you.